Welcome back, everyone. You're welcome to join us for our interactive NCLEX RN review session. And we are currently on day 63 of our 90-day review journey. And we are inviting you to explore our Stancoast NCLEX coaching for a comprehensive NCLEX review course. And it's featuring about 3,000 NCLEX style questions with 20 hours of animated videos for flexible study and 200 hours of recorded lectures to boost your confidence with our on-demand video library and also the practice exams that we have. So kindly visit the website www.stancoastnclexcoaching.com to learn more. And for additional details, click the link below in the description box. And we always value your feedback, so you can share your thoughts or questions in the comments, and we'll be happy to assist you. And don't forget to subscribe, like, and share this video with your friends who are also preparing for the examination. Now, today we're going to focus on our lecture and also exercises on meningitis. So here we go. We have our first question. A nurse is assessing patients for risk factors and etiology of bacterial meningitis. Which of the following statements correctly describe the etiology and associated risk factors of bacterial meningitis? Select all that apply. A, Streptococcus pneumoniae is the most common cause linked to bacillar skull fractures. B, Neisseria meningitidis is common in children and young adults, spreading in crowded areas via respiratory droplets. C, Listeria monocytogenes affects infants and pregnant individuals, often from contaminated food. Or D, gram-negative bacilli are a leading cause in young, healthy adults from respiratory infections. And E, Staphylococcus aureus is common in patients with a CSF shunts and after neurosurgery. And letter F, the Haemophilus influenza type B vaccine has reduced meningitis cases from this organism. So while you are going to respond to this question, I'm going to start rationalizing here. We'll start with letter A. Is it correct? Streptococcus pneumoniae is the most common cause of bacterial meningitis and is often associated with bacillar skull fractures. Well, that is one of the correct answers. Let me just mark this real quick. That's one of the true statements. As we know that the microorganism Streptococcus pneumoniae is the most common bacteria causing meningitis, and it can occur in patients with bacillar skull fractures, which will allow the bacteria to invade into the meninges. Now, this is also associated with cerebrospinal fluid leaks, or let's say in conditions wherein there is sinusitis and pneumonia. So don't forget about that. CSF leaks, especially in conditions like head trauma or TBI, and also sinusitis and pneumonia. PNA, pneumonia. Hello, everyone. Welcome back to our class today. Now, let's move along with option letter B. Neisseria meningitidis is a leading cause of bacterial meningitis in children and young adults and can spread through respiratory droplets in crowded living conditions. Yes, that is a true statement. It is transmitted via respiratory droplets, and it is commonly causing those outbreaks, especially in crowded settings, maybe college dormitories or military barracks. So we will include that in our correct answers. And also in common, this is a common occurrence in children as well, and also young adults. Now let's take a look into letter C, Listeria. You think this is one of the correct statements? Yes, that is also correct, because the Listeria monocytogenes is a food-borne pathogen that can cause the meningitis, especially in vulnerable populations, among pregnant women, also newborns, infants, also the elderly, and those immunocompromised individuals. All right, so that's also correct right there. What about letter D? Gram-neg bacilli are a leading cause in young healthy adults from respiratory infections. Do you think that's part of the correct answers? No, that is wrong, because the gram-negative bacilli, such as the E. coli or the Klebsiella pneumoniae, they are more likely to cause meningitis in neonates, not young, healthy adults. But this is more in neonates. Okay, so this is a wrong statement. And also with the gram-neg bacilli, this is also going to affect those people that may have neurosurgical procedures and also who are immunosuppressed. Neurosurgical procedures, and if there is immunocompromise. Immunocompromise. Now let's take a look into letter E. Staph aureus is common in patients with CSF shunts and after neurosurgery. This is also incorrect. We know that the Staphylococcus species can cause the meningitis in patients with CSF shunts or during the neurosurgery, but this is incorrect because it's not the influenza strain. Rather, it will be the Staphylococcus epidermidis. Okay, Staphylococcus epidermidis, and this is a different strain. It is a coagulase negative Staphylococcus, and it is more commonly associated with shunt placement related infection. Okay, so these are also incorrect answers. So we have the following correct answers: letter A, letter B, and letter C. All right, guys, let's move along with our discussion today. Let's review what meningitis is. We know that this is the inflammation of the protective membranes. Please take note of that. And those protective membranes are the pia mater and also the arachnoid membranes. And they are the structures that will surround the brain and also the spinal cord. So take a look into this photo right here. The arachnoid that is going to be inflamed, and also the pia mater that is also inflamed right here in this juncture. Okay, so the space between these two layers, known as the subarachnoid space, it contains the cerebrospinal fluid, which can show signs of the meningitis. Again, here we have the pia mater over here, and the arachnoid membrane, which is also inflamed. And we have here our cerebrospinal fluid that will also show signs of meningitis. All right, let's exit out of here. Now, take a look, guys, that our pathophysiology and etiology in meningitis, actually, it will depend on the causative microorganism and the contributory factor. But we'll start with the viral meningitis. So what is this? This is the most frequent type of meningitis with over 10,000 cases, rather. And this is going to be about yearly, 10,000 cases every year. Although the actual number may be as high as 75,000 every year, but this kind of meningitis, it can typically resolve on its own, and the treatment will focus on relieving the manifestations since it is a viral type of infection. Now, what is causing the viral meningitis? This is caused by the enteroviruses, and which is the non-polio type of enteroviruses, and this is responsible for about 90% of the cases. And the risk of the viral meningitis actually will decrease with age, and this is going to cause more issues in the younger individuals, not the elderly. Okay, younger people, according to the statistics. Okay, here we go. All right. So what is the mode of transmission in the viral meningitis? Well, this is going to be transmitted via the fecal-oral route or route, and this is associated with the sewage contamination, and this can be transmitted through close contact with the infected person by touching contaminated surfaces. Now, we'll proceed with the next type of meningitis, which is the bacterial type. And in the US alone, it's about it's going to occur within like 3 out of 100,000 people every year, and it has a higher mortality rate, about 10 to 30%, and the survivor of the infection actually will have lasting hearing loss. Permanent hearing loss. Now, what is the causative microorganism in bacterial meningitis? Well, you have it here there. You have the Streptococcus pneumoniae and also the Neisseria meningitidis. And what is really happening here is that the microorganisms will cause the inflammation and eventually will cause damage. And this is known to colonize first. I'm talking about the microorganisms. The bacteria will first colonize in the nasopharynx or the throat area, and then it will eventually invade the bloodstream and also the cerebrospinal fluid, and this is going to trigger the inflammatory response. Now, if you're going to ask about the mode of transmission, this is going to spread through the respiratory droplets. So again, the expected isolation precaution for this patient will be droplet isolation or precaution. It can also be spread through direct contact with the saliva or the nasal secretions of the infected person. Also, direct contact of secretions. Now, if you're going to ask, what are the complications in a patient having that bacterial meningitis? Well, eventually, this will cause brain damage because of the chemicals that are released by the bacteria that harm the neurons. And with that, there's going to be pus formation leading to the inflammation of the brain and also will reduce the blood flow. And it will cause elevation of the intracranial pressure, and this is going to cause some more bleeding, swelling rather, not bleeding in the brain. Now, this time I'm going to talk about the next type of the meningitis, which is the fungal type. And this is very common in the immunocompromised individuals. And this is caused by the microorganism Cryptococcus neoformans, which primarily affects people with weakened immune system. Immunocompromised individuals. Please take note of that. All right, we have the HIV infected people. All right, so that's it about the fungal meningitis, and it is usually brought about by the contact with that fungus that is found in the soil, which is contaminated with the pigeon and chicken droppings. And the diagnosis here is going to be confirmed by detecting the cryptococcal antigen, or could be the culture in the cerebrospinal fluid as well. And the mode of transmission in the fungal meningitis is not going to be, it's not really that contagious, but it is typically acquired through the environment, specifically through the inhalation of the fungal spores. So, again, this is the inhalation of the fungal spores from the contaminated soil. All right. Now let's talk about the other types of meningitis. Here we have the parasitic type, which is actually a rare form of meningitis, and this is caused by the parasites like flukes, worms, amoebas, which will invade the central nervous system, and this is going to be contracted through the fecal-oral route, and of course contamination, ingestion of contamination, food or water, or it could be through contact the skin through contaminated water. Skin contact with contaminated water. Now, let's talk about another type of meningitis here, which is the hospital-acquired meningitis, and this is commonly occurring in people who had neurosurgery, craniotomy, craniectomy, or maybe placement of the shunt. And again, this is caused by the microorganism gram-neg bacteria. And the person who has multiple neurosurgeries will typically develop the infection about a week after the surgery. Infection development. 1 week post-surgery. So please take note of that. And this is, again, the infection is through direct contact with that contaminated instruments. All right, so please take note of that. Now, we have the neoplastic type of meningitis. So what is this? This is affecting about 3% to 8% of patients with systemic cancers. And this is caused by the cancer cells infiltrating the membranes of the brain and also the spinal cord. And most of these cancers are the following: breast CA. It's known to really cause metastasis. The same thing with lung cancer, malignant melanoma, and the same thing with the non-Hodgkin's lymphoma. So these are the common cancers that will contribute to the neoplastic type of meningitis. We are going to include the acute leukemia as well. All right. So again, the mechanism here is the spread of the cancer cells into the meninges. Now, we're going to talk about the metastasis of the meninges, and here we have the last one, or maybe not the last one. This is the meningitis from the untreated sinusitis. So especially for those people that may have a severe form of the sinusitis and they just kind of ignore it, and this can lead to the sphenoidal type of sinusitis, and the bacteria that is involved, or a bacteria that are involved here, are the Streptococcus pneumoniae. We also have the Staphylococcus aureus, and the transmission here is basically the spread of the bacteria from the sinuses into the brain membranes. And again, this is because of the untreated severe sinus infection. And we have the last group of contributory factors. We also have the Listeria meningitis. This is a foodborne type of infection. We know that this is the organism right here, Listeria monocytogenes, which is a gram-neg bacteria. This can cause the meningitis through the contaminated foods like hot dogs, could be cold meats, or even unpasteurized dairy products. So think about that Listeria type of meningitis. Now, how is this going to be transmitted? Well, you see here that this is going to be contracted through the ingestion of contaminated foods, okay, or drinks like milk and pasteurized milk. And then we also have the Haemophilus influenza type of meningitis. This is somewhat kind of declining, and I'm talking about the cases here. And the reason for that is because of the widespread use of the Haemophilus influenza type B vaccine, which is providing the effective protection against the bacteria. And we know of that this is the Haemophilus influenza, right? And the route of transmission from the HIB, or the Haemophilus influenza type B microorganism, is it's contracted through droplets. All right, guys, let's keep moving here regarding the second question. Let's have this item. A nurse is reviewing the diagnostic test results for a patient suspected of having bacterial meningitis. Which of the following findings and tests are consistent with a diagnosis of bacterial meningitis? Select all that apply. Is it A, CSF analysis indicating increased opening pressure? B, cerebrospinal fluid showing elevated protein levels and decreased glucose concentration? C, CSF analysis with a high leukocyte count, predominantly lymphocytes. And we have letter D, blood cultures positive for bacterial pathogens. E, complete blood count showing elevated white blood cell count with a high percentage of neutrophils. And letter F, latex agglutination test detecting bacterial antigens in the cerebrospinal fluid. Again, you are being asked here about the following findings and tests consistent with the diagnosis of bacterial meningitis. You're supposed to select all that apply. All right, while waiting for your responses, I'm going to start the rationals. For letter A, CSF analysis indicating increased opening pressure. This is one of the correct answers because the bacterial meningitis can actually show, it can cause the increase in the opening pressure. And the reason for that, it's because of the inflammation. With the bacterial infection, there is more of a widespread, rapid inflammatory response due to that bacterial type of microorganism. And this massive inflammation can lead to a much more of a higher type of pressure in the CSF. Okay? What about letter B? CSF showing elevated protein levels and decreased glucose concentration. Would that be also correct? Yes, it is. Because in the bacterial type of meningitis, it is going to cause elevation of the protein levels. It can also decrease glucose concentration because the bacteria will require glucose in order to thrive. And this is also increased in the blood-brain barrier, okay? It can actually increase the blood-brain barrier permeability. So that would be another correct answer. Let's have letter C. CSF analysis with a high leukocyte count, predominantly lymphocytes. Do you think it will be higher with the lymphocytes? Let's find out. Well, unfortunately, this is incorrect. Because in bacterial type of meningitis, the lymphocytes are not the primary differential count that is elevated, okay? In the bacterial type of meningitis, let me just write this first. What is elevated here will be more on the neutrophil count elevation, not the lymphocytes. All right, not the lymphocytes. We'll go through with that in a minute. We'll have another discussion about the CSF. What about letter D? Blood cultures positive for bacterial pathogens, as we are talking about a bacterial meningitis type. Well, this will show, it will identify the specific bacteria causing the infection, and this is going to help in the treatment. It will specifically identify that microorganism, and this will lead, or it will help the medical provider to properly select the antibiotic, okay? So this is also correct. What about letter E? CBC showing elevated white blood cell count with a high percentage of neutrophils. This is correct. Like I have said, in bacterial type of meningitis, there's elevation of the white blood cells along with the neutrophils, but not so much with the lymphocytes this time. Now let's take a look into letter F. Latex agglutination test detecting bacterial antigens in the cerebrospinal fluid. Yes, that is also correct because this can rapidly detect the specific bacterial antigens in the CSF. Again, it will help the medical provider in creating or making that quick diagnosis for this bacterial type of meningitis. All right, so we have the following correct answers: A, B. We have letter D. We also have letter E and letter F. So we have an exception here, which is letter C. Letter C is much more of a viral type of meningitis. It's not bacterial. Okay. Meningitis. Again, make sure that you're familiar with the characteristics of the bacterial type of meningitis compared to the viral type. So let's move forward here with our diagnostic test. So here in our patient that has maybe a variety, or we need to really identify that microorganism, right? Or even the history of our patient to have to support the medical diagnosis, right? We need to gather enough data so that the medical provider will be, they will have to identify better the type of infection. Now, let's talk about the clinical assessment first. This is very important as nurses. And for those who are still reviewing for the NCLEX, we need to make sure you are able to differentiate the manifestations here. And so when we are going to deal with this patient with a meningitis, we need to know first the signs of meningeal irritation. And we know that the protective mechanisms or the membranes around the brain, the pia mater, and also the arachnoid level, or the membranes, the meninges, they're going to be inflamed, and they can cause those physical signs that indicate the irritations. And so, guys, we have the first diagnostic sign or clinical sign. We have the nuchal rigidity. So that is one. Please take note. What is that? This is basically the rigid or stiffness in the neck area, and it's very difficult for the patient to move or even to flex, extend, or to move their head, to turn their head as well. And this is a common sign in meningitis, and this will occur because of the inflammation of the meninges, which will eventually restrict their neck's natural movement. Now, when you're going to ask the patient to try to bend their neck forward or to flex it, they're gonna actually feel that resistance, and there will be some pain due to the inflammation and tension in the neck muscles. And this is going to be accompanied by headache as well. And then following that, we also have the Brzezinski sign, which is positive. So if you are going to test this, how are you going to do this testing? Well, to check this sign, you're going to have to put the patient lie flat on their back or in a supine position. And what you're going to do here is to gently lift their head towards their chest. Now, you will be signifying this will be positive if the patient's hips, right here, if the patient's hips, knees, or the ankles, if they're going to flex as a reflex when you lift their head, it indicates that there is meningeal irritation. Again, when you're putting them in a supine position and as you're going to gently lift their head, this is going to cause the hip, the knees, and their ankles to flex involuntarily. Involuntary flexion of the hips, the knees, and ankles. Please take note of the keywords here: involuntary flexion in those joints whenever you're going to gently lift their head towards their chest. Now let's talk about the second one, which is the positive Koenig sign. What is this? This is going to be done specifically. You're going to put the patient in a supine position or on their back, and you're going to straighten one leg. So one leg will be straightened while you're going to keep the other hip and knee bent in a 90 degrees angle. Now, how are you going to interpret if there is a positive Koenig sign? When you're going to slowly straighten the bent leg, after you flexed it, when you're going to straighten it, the patient will experience a lower back or a spasm in the hamstring, okay? Or could be the thigh. And if there is noticeable resistance to further straightening, it suggests that there's also meningeal irritation. Again, this can elicit lower back or spasm in the hamstring. Lower back, spasm in the hamstring muscle. And there's also noticeable resistance to further straightening as you're going to try to straighten this flexed knee. Okay. So what's the reason behind the Koenig sign? This is basically caused by the stretching of the meninges, which are inflamed, and the resulting pain and the muscle spasm are due to the tension placed on these inflamed tissues. And the hamstring spasm is actually elicited as a protective response to further stretching of the meninges. Again, this is caused by the stretching of meninges. Now this time, guys, we're going to talk about the different diagnostic tests. This is going to involve so many series of tests and also evaluations that will determine the presence of the type of the infection affecting the meninges. So what are those diagnostic tests? First, we have the CBC, which is going to detect any elevation of the white blood cell count, wherein there is elevation, could be elevation of the neutrophils or it could be elevation of the lymphocytes. Now, take note here, guys, that with a bacterial meningitis, there's going to be significant white blood cell increase and also neutrophils. Whereas in viral meningitis, there will be slight elevation, but there is specific increase in the lymphocytes. Please take note of that. Now, why? We have the reason right here. All right, let's talk about the blood cultures. What's in the blood culture? Well, if this is going to be a bacterial type of meningitis, it will show a specific bacteria in the blood. That's going to be expected, right? In the blood culture. Now, if you're going to have the CSF evaluation, this will be specific to bacterial type of infection here. The findings are the following, wherein the CSF pressure will be elevated. Please take note about the bacterial meningitis. There's going to be elevation of the CSF pressure, and the reason for that is because of the widespread inflammation of the meninges. The bacteria will cause more of an acute inflammation, and that is why the pressure is higher in the bacterial type. Now, there's going to be elevation of the white blood cell. The patient will also have elevated protein in the cerebrospinal fluid. There's going to be a low glucose, as I have mentioned earlier. The bacteria will feed into the glucose, and that is why the glucose in the CSF will be decreased, whereas the bacteria will be easily identified through the culture and smear. Now let's compare it to the viral meningitis, wherein there's also moderate elevation of the CSF. As I've said earlier, it is so different compared to the bacterial type, because with the viral meningitis, the pressure is actually close to about normal or slightly or moderately elevated because the inflammatory response in the viral meningitis is less severe compared to the bacterial type. And so there's going to be less pronounced changes in the pressure. Now, talking about the elevation of the white blood cells, this is more specific to the elevation of the lymphocytes. It's going to be more on the lymphocytes, but the neutrophil, not the neutrophil rather. Now, the protein is supposed to be normal or slightly elevated, and then the glucose in the CSF in the viral type meningitis is normal because there's no, the virus actually will not feed into the CSF glucose. All right, guys, let's move on into the other diagnostic test here. The MRI CT scan will be also useful. This is going to rule out other neurological problems or disorders that could mimic the meningitis. We also have the latex agglutination test, which is going to detect the antigens from pathogens in the cerebrospinal fluid. And we also have the CD4 count, which is going to be useful in those patients that may have the HIV type of infection. And this will measure the CD4 T cell counts, especially with the HIV positive or for those patients that may have immunosuppressive disorders. And so if the CD4 count is reduced, this is going to suggest that there is weakened immune system, which will increase the patient's risk to developing infections such as the meningitis. All right, let's talk about the management. We're going to talk about the precaution. We're going to have to apply or implement droplet precaution for the bacterial type of meningitis. We're going to have to make sure collecting the cultures before we initiate the antibiotics. Of course, we are going to base the antibiotic therapy on the microorganism that is identified. And supposedly the antibiotic treatment should be started right away as soon as the microorganism or as soon as the blood culture has been done. The medical provider will order that antibiotic, could be the broad spectrum type of antibiotic, to treat the infection. And this is what we call as empiric antibiotic treatment to get coverage. Well, we're also going to have to manage the inflammation in the meninges, and this is going to be implemented through the administration of the steroids. We also have the treatment here for the neoplastic meningitis. We're going to have to employ administration of the chemo and also radiation. And for those patients that had the permanent effects of the bacterial type of meningitis, they're going to have hearing loss, and they're going to require to have the cochlear implantation for the hearing loss. Cochlear implant in order to restore their hearing. All right, guys, and also for those the fungal type of infection, we're going to treat that with the antifungal therapy, of course, and the common medication for that would be the itraconazole, or could be the fluconazole, or could be the amphotericin B, which is the first choice in the treatment. Amphotericin B, that is an antifungal drug. And we also have the triazole medications, antifungals. And if the patient has the meningitis caused by the tuberculosis microorganism, then we're going to treat that with the anti-tubercular medications immediately once it is identified. Now, what are the nursing applications here, or nursing actions that we should be providing to our patient? We're going to have to reduce their fever. That's really important, as we know that with the increasing temperature, it can increase the metabolic demands of the body, the more that it can cause swelling in the brain. We need to control that. It can lead to increasing ICP. And part of the care here is to maintain the fluid balance as well. We don't really want to cause overload into our patient, as we know that there is cerebral edema as a complication. We're going to make sure that we are checking on the eyes and nose carefully, avoid overload of the fluids, and we're going to do and take an output measurement religiously. And what else? We're going to have to maintain cerebral perfusion in our patient. We'll check the neurological function of our patient, GCS, vital signs, and we're going to watch for those signs of increasing ICP as well. And part of the care here is to provide them a quiet environment, less stimuli. And we're going to also assist them in those invasive procedures such as the lumbar puncture, especially if there's a need to collect the CSF. And we will notify the medical provider if there will be worsening of their manifestations, maybe fever, decreasing LOC, seizures, changes in their breathing. Part of the care here is to reduce their pain. We're going to have to give them the medications, analgesics that are prescribed. This will decrease the metabolic demands as well. It will also lessen the increase in the ICP, okay? Because whenever there is increasing pain, the more that it will aggravate, it will cause the ICP to increase. Now, part of the care here is to manage light sensitivity. We know that they are photosensitive, so we're going to provide them a quiet, dark room. We're also going to put them in a comfortable position to, we're going to have to reposition them carefully while keeping the head and the neck aligned. And also elevate the head of the bed slightly, about 30 degrees angle at least, to lower the ICP. Now, we're also going to promote mobility in our patient even when they're in bed. So we will be promoting gradual exercise, slowly, gently, but not really expected during the acute phase. Okay. What else? We're going to have to do some referrals, recommended occupational physical therapy as soon as possible when the patient is regaining their function. Now let's proceed with our test questions here. Let's have number 3. A 24-year-old male college student is brought to the ED by his friends after developing fever, neck stiffness, confusion, and severe sensitivity to light. On admission, his vital signs are as follows: temperature 105 degrees Fahrenheit, respirations 20, blood pressure 120/75, pulse rate of 92, and pulse oximetry 99% room air. Examination reveals a confused male with nuchal rigidity. A fundoscopic exam shows bilateral blurring of the optic disc margins and retinal venous engorgement. Which of the following provider orders should the nurse anticipate first in coordinating with the healthcare team in managing this patient? Is it A, CT scan, B, MRI, C, lumbar puncture, D, administer empiric antibiotics, E, administer empiric antiviral therapy? You got a lot of data here in our scenario. There's elevation of the temperature, the pulse rate, oximetry, respiration, blood pressure. They're quite in this, within the normal range, but there is photosensitivity that is severe. There's neck stiffness, confusion. What else? We have blurring, bilateral blurring of the optic disc margins. There's retinal venous engorgement. So what order you should prioritize, or not really prioritize, but anticipate to be carried out first thing in this patient? So is it A, B, C, D, E? This is not a select all that apply, but this is a multiple choice, but you have 5 options. So let's go through the following. Let me start with letter E. Administer empiric antiviral therapy. Well, this is going to be useful if the patient has the viral meningitis, but this is going to be implemented only after initial imaging and evaluation has been completed, or if there's already ruling out of other causes. So we are putting this away. What about letter D? Administer empiric antibiotics. This is also very important, but it is not typically the first intervention. We want to make sure that a CAT scan is done first to guide further management. What about letter C? Lumbar puncture. Will this be the primary anticipated action? We know that the lumbar puncture is very crucial in diagnosing the meningitis, but it is not usually performed after a CAT scan. So again, CAT scan would be our primary action that should be performed before anything else, even before the MRI. Okay. And what is the reason about the CAT scan really? Well, this is going to be done first, especially if the person has suspected meningitis, in order to rule out those possible contraindications. Possible contraindications to the lumbar puncture, maybe increasing intracranial pressure. So this should be identified first to detect increase ICP, because if there is already increasing ICP before a lumbar puncture, or I should say a much more severe type of ICP increase, this is actually going to contraindicate the lumbar puncture. Okay, this can cause herniation. The lumbar puncture will lead to brain herniation if the CAT scan was not done first thing. All right, let's move on to the next item, number 4. A patient with bacterial meningitis is confused and nervous. What nursing intervention would be most beneficial? Is it A, invite family members to stay by the patient's side? B, use soft restraints to prevent the patient from injuring themselves? Letter C, ensure the room is brightly lit to help the patient stay oriented? D, reduce sensory stimulation by limiting contact with the patient. All right, you can pick the answers or the answer while I'm going to start rationalizing this time. For letter D, reduce sensory stimulation by limiting contact with the patient. This would not be helpful in some cases. I mean, the reduction of the sensory stimulation is important, but there's also a need for the patient to have at least some comforting presence, maybe a family member that is going to be available, which can actually reduce their anxiety. And as we know, anxiety can also increase their ICP. So this will not really be the best answer. What about letter C? Ensure the room is brightly lit to help the patient stay oriented. No, this is incorrect, because our patient with the meningitis will have photophobia. And this can worsen their discomfort, can cause anxiety, and it can also lead to some more increase in their ICP. What about letter B? Use soft restraints to prevent the patient from injuring themselves. The application of restraints can exacerbate their agitation and also their anxiety, and as much as possible, we should avoid that. And so the correct answer here is letter A, invite family members to stay by the patient's side. The presence of familiar faces can actually reduce the anxiety in this patient. It doesn't mean that they're not doing their PPE. Of course, they're going to have to wear their PPE. The patient is placed on droplet precautions. And so it doesn't mean that they're exposing themselves without wearing those protective barriers. So this can be helpful for this patient in this scenario, especially if they are confused and nervous. Number 5, a patient with meningococcal meningitis is observed in which situation? A patient with meningococcal meningitis is observed in which situation would require immediate action by the nurse? Is it A, the patient is receiving their standard meal tray, or B, both sides of the bed are equipped with raised side rails or bed rails? Letter C, the room lights have been turned off by the staff, or D, the staff enter patient's room without wearing masks? All right, while you are picking the answer, I'll start rationalizing. Let me have letter A, the patient receiving their standard meal tray. Will this call for an immediate action by the nurse? No, that's incorrect. A regular diet is usually acceptable unless specific dietary restriction has been prescribed. What about letter B? Both sides of the bed are equipped with raised bed rails. This is incorrect. Elevated bed rails are generally used for safety in patients with reduced awareness. Guys, be careful when you are raising the side rails, especially if there are 4 bed rails. You don't have to put those all 4 rails. That's already considered as restraint. Let's have letter C. The room lights have been turned off by the staff. We know that dimming the lights will help alleviate their photophobia, right? So this is going to be discarded as well. This is not something that the nurse should take immediate action. However, with letter D, the staff enter the patient's room without wearing mask. We know that with a patient that has meningococcal meningitis, this is the bacterial type. This is going to be spread by the droplets. And this is a break in the observance of the precaution. It is highly contagious through the respiratory secretions. So the staff should be reminded, always use the required PPE, especially wearing the mask. So our correct answer here is letter D. Let's move forward to number 6. In assessing a 53-year-old patient with bacterial meningitis, which finding requires immediate attention? A, the patient shows neck stiffness. B, the patient has a positive Kernig sign. C, the patient's temperature is 101.5 Fahrenheit or 38.6 Celsius. And D, the patient's blood pressure reads 89/40 mmHg. Please take note about the assessment findings here. Let me try to eliminate letter A first. A is incorrect. This is an expected symptom of meningitis. Expected symptom. What about letter B? The patient has a positive Kernig sign. It is also expected. Because of the meningeal irritation, yeah, this doesn't really call for immediate attention. Let's take a look into letter C. The patient's temperature is 101.5 or 38.6 degrees Celsius. This is a typical finding in bacterial meningitis. It is also expected. It doesn't require urgent action. All right. So we are left with letter D, which is basically showing us hypotension in our patient. Blood pressure is 89/40. Your patient here is hypotensive. This is signifying shock, which is a severe complication of meningitis that you should act on immediately. All right. So our correct answer is letter D. Let's move forward to number 7. A patient with bacterial meningitis has a fever of 102, 38.9 degrees Celsius, and a severe headache. What should be done first? Is it A, start ceftazexime IV, B, administer acetaminophen 650 milligrams PO, and letter C, apply a cooling blanket to lower the temperature, D, obtain a nasopharyngeal swab for cultures? What you should do first, especially that you have collected this information, the fever of 102, severe headache. So let me start eliminating these answers. What about letter A? Start ceftazexime IV. This is the antibiotic therapy, right? This is critical, but this is only done after culture has been collected. Should collect culture first. So this is incorrect. What about letter B? Administer acetaminophen 650 milligrams PO. We know that this is also important, right? But this can be administered once after initial diagnostics has been completed. We need to make sure that all those diagnostic testings has been carried out first. All right, let's see letter C right now. Apply a cooling blanket to lower the temperature. We know that cooling methods can be used, but should follow after the diagnostic tests have been completed. So what you should do first, we are going to collect the swab, the nasopharyngeal swab full cultures. This is very important to carefully plan the treatment. And also this will call for, this is basically needed before initiating the antibiotic therapy, the empiric antibiotic therapy. All right. We need to have identification of that microorganism first thing. So the answer is letter D. Let's have number 8. After a lumbar puncture, a patient with suspected viral meningitis is admitted. Which prescribed action should the nurse question? Is it A, limit oral fluid intake to 1,000 mL per day? Or B, raise the head of the bed by 20 degrees? C, administer ceftriaxone 1 gram IV Q12 hours, or D, provide ibuprofen, Motrin 400 milligrams every 6 hours as needed for headache. What do you think? Which prescribed action should the nurse question? While you do your picking of the answer, let me have letter D, provide ibuprofen 400 milligrams every 6 hours. This is a suitable management in the treatment of the headaches related to the meningitis. So we're going to eliminate this because the task is asking for you to question the action. So letter C, administer ceftriaxone Rosafin 1 gram IV Q12 hours. This is the antibiotic therapy that is appropriate in treating the bacterial meningitis. So this is something that you should eliminate as well. What about letter B? Raise the head of the bed by 20 degrees. Elevation of the head, even at 20 degrees, is appropriate to reduce the headache. Again, this is to reduce the headache. And the 20 degrees is not really that significant, especially after a lumbar puncture. Slight elevation, guys. This is not that significant. Elevation of the head by 20 degrees. That's not a whole lot. So we are going to pick on letter A, limit oral intake of 1,000 mLs. This is incorrect. I mean, this is the option that we should be selecting. We should question because patients with the meningitis need some fluids to prevent dehydration, and also it can support their recovery. So we have letter A. And then finally, we have number 9. For a patient with suspected bacterial meningitis, which assessment finding would be expected? Is it A, pain with the foot is dorsiflexed, or B, neck flexion causing knee and hip flexion, C, inability to stand with eyes closed and arms extended without swaying, letter D, numbness and tingling in the legs. Take your pick. So this is a patient with suspected bacterial meningitis. So it's asking which assessment finding would be expected. So let's have letter A, pain when the foot is dorsiflexed. This is something that you can assess in a patient with other conditions, not specific to the meningitis. So we are marking this wrong. What about letter D, numbness and tingling in the legs? Another non-specific manifestations. These are not typical initial findings in bacterial meningitis. What about letter C? Inability to stand with eyes closed and arms extended without swaying. This is what we refer to as the positive Romberg's test. This is the inability to maintain balance when they are closing their eyes with their arms extended. This is not the primary sign of the meningitis as well. So the correct answer here is letter B. What is letter B? This is the Brudzinski sign, wherein there is going to be that flexion. It will elicit the flexion of the hip, the flexion of the knee, and also the ankles. And this is an indication that there is irritation of the meninges. Again, this is what we call as the Brzezinski's sign. And finally, we have our last question. For a 55-year-old patient with suspected bacterial meningitis, which factors are associated with worse prognosis? Select all that apply. Is it A, blood pressure higher than 140/90 mmHg? B, heart rate exceeding 120 beats per minute? C, advanced age? D, low Glasgow Coma scale? And E, lack of previous immunizations. It's asking you about the factors that are associated with a worse prognosis in a patient with bacterial meningitis. Select all that apply. All right, let me pick letter A. Blood pressure higher than 140/90 mmHg. What does that mean? This is incorrect, because the elevation of the blood pressure is not specifically linked to poor outcomes in meningitis. We are marking that. That is wrong. What about letter B? Heart rate exceeding 120 beats per minute. This is an indication of severe illness, poor prognosis. So we are going to pick that as one of the answers. What about letter C, advanced age? We know that older age is associated with a higher risk of poor outcomes, especially in this condition. So that's another factor. What about letter D, low Glasgow Coma scale score? Of course, if the patient's score is less than 8 or 9, there's now a significant neurological impairment. This will really determine a poor prognosis. So that's also one of the answers. And what about letter E, lack of previous immunizations? Would this matter? While we know that the immunization status is important, but it is less directly linked to the immediate prognosis compared to the other factors. We know that immunization is important, but then again, it's not directly linked to the immediate prognosis of our patient. So we are marking this wrong as well. So we have our correct answers: B, C, and D. And so that's it for our session today. Thank you for your attendance. And again, we are encouraging you to enroll in our NCLEX course via www.stancoast.coaching.com, or you can click on the description box below to know more about us. And again, thank you for your participation today. You all take care, and you have a great day, evening, or afternoon. Bye-bye. You all take care, guys.